Hi, it's Dr. Beluja. So today I watched this amazing video on natural treatment for patients that are having end-stage kidney disease. And this is by a doctor in Korea. And this doctor basically says that there's this, end-stage kidney disease, creatinines of 5 and above, and people that are actually on the dialysis can actually be saved by different sorts of methodologies. And the question is this real or is this not real? And I don't know the answer, but when you look at the actual YouTube video, I'm going to share my screen. When you look at the actual YouTube video, hopefully you can see my screen. Um, you can say this says, what's it called? Kidney failure, renal failure by Dr. Kid Ong Im. And I put a little survey monkey here link in the actual description to see if this is actually something that's real. And what he recommends is number one, brown rice, and number two, vegetables. And after doing this brown rice, vegetable, and exercise routine for 6 months, you can decrease your creatinine level. And he's showing some examples of patients that have actually done this. And he's not charging at all for this information or this therapy. And he has what's impressive is he actually shows a list in his video. So I'll put a link right here. Um, he shows the link in his video. So the question is can diet, like right here, he says the creatinine was up at 23, and a patient that started, and after 2 months, 20, 3 months, 15.5, then 4.7, then 2.9, then 1.70. That's pretty impressive if that's, what's it called? And that's just a diet consisting of brown rice and fruits for 6 months. And he says this right here in his brown rice and raw foods, raw veggies and fruits for 6 months. So he's saying go to a raw diet. I'd like to know if this is actually real. I'm putting together a study to find out if this is real and to give this an actual score on Nitai Gorongo. I have no a vested interest, or I have no fiduciary interest in this. We just want to know if this is actually working. We want to collect data to see if this is actually working for patients with Jagannath Health. Thank you for watching this video. We will update people as time goes on. And then soon, if this is actually worthwhile, we'd like to actually invite uh, uh, Dr. Im for a interview and go from there. But he sounds very solid in this video. Recommend you watch this video. Whether you actually want to pursue the treatment or not, that's up to you, but sounds like he has a vast range of experience. Thank you very much. This is Dr. Beluja. This is Nitai Gorongo. This is a public health show. And this is a public health issue. Patients who have creatinine bumps and need to undergo kidney transplant. I have one patient that's about to go for a kidney transplant very soon. I'm a neurologist, but we have one patient that's going for a kidney transplant very soon. So we're concerned about him. And he went recently for a dialysis catheter, and he refused the catheter because he said, no, I want to get a diet. And I'm like, oh, geez, So usually I recommend my patients take the middle of the road. They take the allopathic and they take their naturopathic therapies and try to do the middle. What he said is, no, I want to wait it out. So if he's going to wait it out, then I was like, okay, let's find all the data that we can on the actual diets and in the setting of diabetes, of course, and then go from there. And Dr. Kid Dong Ying is somebody that I've researched for my patient. And now I want to find out more. Is this something that's actually real? Are patients experiencing this? Now, if you scroll down in the comments of the video, it says, there's a lot of doctors suffering greatly. I'm just reading these comments. I would just like to thank you for caring. We all must go through hardships in our lives, but thanks to people like you, it makes a difference. It looks legitimate. And then there's, but I really want to find out more. And I want to have more structured data to be able to show my patient population to say, look, we agree with Dr. Kidong Im's methodology, or we don't agree with it. And if we can collect enough data, like, if I have 20 or 30 patients that I can show my patient, I can say, look, this might be something to actually look into. Thank you very much for joining us.